What we're in at the moment is a vicious cycle where our median waiting times for CAT2 elective surgery are the worst they've ever been. People are in pain. We estimate about 20% of people are unable to work. There's strain on carers. There's increasing mental health problems. So we're absolutely straining at the seams. And the longer we leave that, the worse it's going to get.
Surgery can be exhausting, both physically and mentally. Sometimes you're operating for 8 to 10 hours straight. And when talking to the patient's family, you have to prepare for the worst case scenario as well. We train excellent surgeons in Australia. However, becoming a surgeon is a long process. Our population is aging, and we need to ask ourselves how we can improve surgical care for both our patients and support our surgeons in the future. My name is Vijayaragavan Muralidharan. Most people call me Murali. It has been a long time since I was a young student in Sri Lanka. Surgical technologies have advanced so much over the course of my career. Future innovations will be so advanced that long and complex procedures will be a thing of the past. An example is blood-based DNA analysis that could potentially take years off colonoscopy waiting lists. Costs will be lower, operations will be less invasive, and life-changing procedures will be more accessible. Education is a lifelong experience. As surgeons, most of the learning we do occurs on the job. I wanted to do my part in teaching the next generation of surgeons, so I undertook the Master of Surgical Education delivered by the University of Melbourne. This gave me the experience and expertise to design and implement surgical education programs across Australia. Being able to establish a program which focuses on patient-informed care means our trainees benefit from the best knowledge that's available today. We are working with patients and their families to give them agency over their own treatment. When to do surgery and when not to is a choice you make together. It's about the relationship you build with your patients and their families to place them at the center of their own health care. I always ask my patients, what do you have to live for? What is keeping you here? Because surgery is not just a once-off event. It's a journey, sometimes one that can take many years. I have learned that the most important thing we can do is pass on our knowledge and expertise. You know the saying, teach a man to fish, he feeds himself for the rest of his life? Well, I like to say that if you teach a man how to teach fishing, you will feed the whole village. In the ways we innovate, in the ways we care for our patients, the ways we teach our students. This is how we will prepare for the challenges we will face in the future.